told that you're experiencing an allergic reaction on your neck. Yeah, from an insect bite. Okay, may I see it? Okay. Are you experiencing any tightening in your throat? Any lightheadedness? Okay, that's great. I think we are safe to proceed and we don't need to treat you for anaphylactic shock. Okay. First, I'm going to ask you some questions and listen to your heart and lungs. Okay. Listening to your heart first. Okay. And your lungs here, can you take a deep breath for me? Okay, on this side, deep breath. Okay, around back. Very good. Other side. Your lungs sound good. Have you ever experienced an allergic reaction before? Not like this, okay. Have you ever had an allergy to an insect bite? Okay. And have you ever had allergy testing done? Okay. Are you feeling itchy? Does it hurt? Yeah. Okay. Do you mind if I dictate my notes for our visit? I'll just be speaking into a recorder and it helps me maintain your health record. Okay. Patient has no known history of allergies and no existing respiratory conditions. Reports occasional sinus inflammation. We have redness at site of bite. No signs of anaphylactic shock. Patient's lungs and heart are normal. Have you ever seen an allergist before? No? Okay. I'm glad you're here. I'm just taking a peek in your nose now. Can you open your mouth for me? Say, ah, yeah. Okay. I'm gonna take a look at your eyes. Look right here for me. Okay. And let's look at your ears. Are you taking any allergy medication? Patient's not taking any allergy medication. Eyes, ears, mouth, nose, normal. I'm going to slip this on your arm. Okay. You'll feel a little squeeze, okay? 118/75. Blood pressure 118/75, normal. Now we're going to get into the exam portion. I'm going to take a look at your bite first. I'm going to measure it and record it. And then we're going to do some testing. Have I spoken to you about skin prick testing yet? Okay, I'll explain in a moment. Let me see your neck here. I'm going to turn your head slightly. I'm going to measure. Thank you. Okay. The wheel of this is about 3 centimeters. Wheel of bite 3 centimeters. I'm going to get a drawing of it. All I'm going to do is lay this gently over top of your bite. Then trace it with this Sharpie. And that will go into your record so that we remember what it looked like, okay? Alright, hold still. I'm tracing now. Okay. This is what your... One moment. Here. This is what your bite looks like. It's about this big. Yeah. You do have some inflammation that extends slightly further, but it's not red. So, this little paper will go right into your medical record. Isn't that nifty? Yeah. And if you would like a copy, I can print one out for you at the end. Okay. We're going to do a skin prick test. This test contains a panel of many, many allergens, nearly all of them. I'm going to press a tool that looks like this onto your skin, and it will feel a little itchy, but it shouldn't hurt. It doesn't go very deep. Okay, and it looks like this. You can touch it if you like. This is a demo. See, they're not very sharp. Yeah. They're really not. And it's gonna go right on your arm. This is just a cleaning solution. So if I could have your arm. Thank you. Normally, my assistant would be performing the testing, but she's not in tonight, and I think your case is very unique. I want my eyes on the tests personally. Other side, okay? So you're in for a treat, I guess. Kelsey's wonderful as well, but considering you've never experienced a severe allergy before, I think it's best that it worked out like this. Okay. Into the bin. No, it won't penetrate deeper than just your skin. You won't bleed. It might feel itchy and it might look like a small scratch on the skin. It's not the most comfortable thing initially, but it's nowhere near as painful as a shot, for example. No. I think, some people enjoy it, really. Yeah. But we'll go at your pace. I'm doing a full panel of skin prick. Okay. Here's your panel. First, we're gonna do insect bite allergens. I'm gonna label that on your arm, so can I have your arm? Thank you. Okay. Now I'm gonna press this onto your arm. Ready? Five, four, three, two, one. Okay. All done. Next, we have environmental allergens. Okay. A little bit lower on your arm down here. Okay, let me mark that. Okay. And we're pressing right now. Good job. 5, 4, 3, 2, 1. That's it. This panel is household pet allergies. pressing 3, 2, 1. 5, 4, 3, 2, 1. That one's done. Okay. Now we're going to let those rest for about 20 minutes, okay? I've got one more thing I need to do, and that is your control test. We want to make sure your body isn't just reacting to anything. So I have a saline solution we're going to put, it'll be on your back this time. Yep. And if that produces a reaction, then we know something might be amiss with our testing. I also have, same thing, another positive control that will guarantee a reaction in everyone, so we know for sure you're having reactions. So I'm going to do those 2 special tests now. Okay. I find that having my gloves off for this one is a little easier because the tools are a little finicky, so I'm going to be very careful to protect myself, yeah, and protect you too. Okay, I'm actually going to go right on your shoulder over here. Okay, very good. Now this is the tool I'll be using. And how it works is you pull it out. Makes a little click. And when I push this button, it will send forth a tiny prick. Again, this prick will not break the skin. It will scratch it lightly, but you're not going to bleed. No, yeah. Okay. So I'll get it ready. All loaded. I'm going to do your control now. That's it. Did you feel it? Okay, good. I'm glad. This is a more scary device because it can puncture the skin if you increase. Yeah, and I think many people have seen this device before, especially if they have a diabetic in their lives. Yeah, so I try to reassure my patients. Okay, and we have our histamine as well. This is our histamine that should produce a reaction. Okay. 3, 2, 1. Time to mark those so I don't forget. Control and histamine. Okay, it's time to record your test results. I can see already gonna have some reactions. I'm gonna circle those now. Okay, we have our first set. Second set, not too bad. I'm going to use the same sheet actually for your other panel. These ones are large. This is concerning for sure. That one is fire ant. Yeah, it does make me wonder about your insect bite. Perhaps fire ant. Okay. This one is just your histamine and your control, and those look as expected, which means our tests should be very accurate. This is calamine lotion. It's gonna soothe that itch. Yeah. Right on your bite. I've got some contact paper for your bite as well. This will help prevent you from itching. Yeah. Okay. I'm gonna place this right here on your neck, okay? Alright. Now, you leave that be. You can take it off when you shower, but it will help, at least for tonight, prevent the itch and keep your fingernails away from it as much as you can. Okay. Well, I think you're in really good shape, and we've learned a lot about your allergies today. I'll print out all of your allergens and an information sheet for you. That way you can learn about them. For now, I am going to prescribe you an EpiPen. If you've never used an EpiPen before, I'm going to point you in the direction of some really excellent videos on YouTube for how to practice, how to get accustomed to it. If you ever experience your body tightening up, going into anaphylactic shock, use the EpiPen. It'll save your life, okay? It will save your life. It is good to have around. In the meantime, with your seasonal allergies, I really recommend an over-the-counter antihistamine like Claritin, not the Claritin decongestant, the kind without D, okay? And you're safe to take that every day, once a day. Truly, you're safe to take that. It helps a lot of people. It's not going to hurt you. Yeah, if you're noticing that sinus pressure and congestion, Flonase is another good option. I can write a prescription for Flonase if you would like. It's also available over the counter. Yeah, I'm happy to. So we're gonna do an EpiPen and a Flonase script and sending it to your pharmacy on file. Beautiful. It's been a pleasure to treat you today. Is there anything else I can help you with? Any questions you have? Any concerns? This is totally perfectly normal. I'm just glad that you're feeling better. You're not having the throat tightening type reaction. That's really important. And that's what the EpiPen is for. I think we'll follow up in 3 months and see if you've had any further reactions, kind of see where you're at as far as your seasonal allergies go. Okay. I'll see you in 3 months then. Have a great